Welcome to Alzheimer's Sunrise, lighting the way for patients and caregivers on Legends 100.3, brought to you by Alzheimer's Community Care, providing help and hope for thousands of families for the past 20 years. Here's Mary Barnes, CEO of Alzheimer's Community Care.
Welcome to Alzheimer's Sunrise, shining a light on patients and caregivers. We are on Legends Radio, where legendary music lives, 100.3 FM. My name is Karen Gilbert. I am Vice President for Education and Quality Assurance for Alzheimer's Community Care.
And I'll join you, Karen. I'm Mary Barnes. I'm President and CEO of Alzheimer's Community Care. You did that very, very well. We just learned about how the call letters LML means where legendary music lives. And so we live here too. So now this is great.
Absolutely. And this music does wonders for our patients in our day centers.
I'll tell you, it's part of their DNA. And, you know, when you're talking, music, of course, is they say music of the soul. And it's true. There are all kinds of different types of, with the beat and with the sparkle in their eye. And, every time music comes on, especially if it's of the era and of the kind of, magic time with those kinds of, when you're dealing with swing, when you're dealing with the very personable notes. And, an Alzheimer's patient, or you really have to have that in the house and in their life all the time, because that's where the starvation comes from.
It's incredibly therapeutic. They remember the words. It doesn't matter how profoundly they're affected. More than 3/4 of those who attend our day centers have severe cognitive impairment.
Yep.
But when the music comes on, they can sing every word.
And I'll tell you, some of them can move pretty good, too.
Yes, they do.
I can't even keep up with them, so it's really...
Yes,
we were
they
talking
do.
about, one of the things that in the past we've talked about many things about Alzheimer's and about the different other types of related disorders, but healthy aging versus neurocognitive disorder.
Very important distinction, because so many family members may think, well, mom's getting older, it's typical of aging. Permanent memory loss is not healthy aging. Personality changes, dramatic behavioral changes are not healthy aging. These are warning signs. These are red flags that something is going on. So important is, in healthy aging, you retain the ability to know safe from unsafe, reasonable from unreasonable, and your personality and your behavior does not change significantly.
No.
So that's the moment where we want families to get together and say, we need to get an evaluation. We need to see what's going on.
Alzheimer's disease has been called an insidious disease. And the reason why it's called an insidious disease because it comes on so very slowly. And when you start seeing the subtle changes, we become very passive about it because, he must be having a bad, he didn't sleep good last night. So there's all kinds of excuses. And what is so important is the earlier you can get the diagnosis, the earlier you can get the help and understand the medical understanding, that's what is going to be able to kind of make plans and kind of like figure out what your life is going to be like going through that process.
Well, and here's one of the major opportunities you have when you act early. Those symptoms, and previously we've talked about symptoms of dementia, which include memory loss and the inability to carry on what we call executive functions, paying the bills, operating the washing machine,
driving a car. When those things start to fail, there could be a treatable cause. But we that are in trying to get a diagnosis, when we hear the word, well, he's got dementia, well, that, I just want to iterate that is not a diagnosis.
Exactly.
And how to get the kind of medical care that is required is important for having that appropriate diagnosis.
Exactly. The message we try to get out is that we do not want to accept dementia as a diagnosis. The patient or the caregiver needs to ask why. Why do we have symptoms of dementia? Again, we have so many treatable conditions. Clinical depression is treatable
Yes.
If untreated, symptoms of clinical depression will produce symptoms of dementia. There could be what we call a subacute infection, an infection that's not producing fever or pain, but is there all the same. Urinary tract infections, very common. Early pneumonias. Might not have any outward signs, certainly treatable. Hypothyroidism, which is underactive thyroid, very common as we get older for men and women, if untreated, will mimic symptoms of dementia. Vitamin deficiencies, B12. All of us over the age of 50, we have a hard time hanging on to B12. We need to have it in our diet. If we don't eat much meat, we don't have it in the diet.
No.
So regardless, many physicians believe everyone over the age of 50 should be taking B12, and anyone who's vegan, who doesn't eat animal products, would need it no matter what the age. They could be, my daughter became a vegan at age 12. And is quite low in B12. So it's definitely something that must be looked at every year. When you have your physical, poorly controlled blood sugar, diabetes is rampant in this country.
And it is actually a precursor to somewhat for starting some form of neurocognitive disorder. If it's not actually stabilized and if it's not treated throughout the history. It doesn't mean automatically that you would become have a neurocognitive disorder, but those are the risk factors.
Higher risk with diabetes, which also presents a higher risk for heart disease and stroke. And so getting ahead of diabetes is critically important.
Well, we're back here at Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio 100.3 FM. And, Karen, this line of discussion leads us to so many different directions. And one of the big heartaches that we have at Alzheimer's Community Care is that the medical doctors do not have a set of principles for families to follow. And I know that we've said this before in the past, but it's worth keeping on saying it because our families are not able to embrace and get some sort of pathway of medical attention or getting a good care plan. We can't work with the diagnosis of just hearing dementia.
Right. You're absolutely right. And I know in my annual physicals, I'm asked, have I had a mammogram? Have I had my colonoscopy? No one asks what I've done for my brain.
That's true.
And we are not addressing the brain the way we address the rest of the body preventively. That really needs to change.
Why do you think that is?
Hard to say. I've been a nurse almost 43 years. It doesn't make any sense to me at all how we can ignore what we know is pretty much epidemic. We have more than 500,000 in the state of Florida, people who are said to have Alzheimer's disease. You and I know that most do not get diagnosed until middle stage.
Yes.
So there could be 100, 200, 300,000 more who are at that early moment we talked about, just showing those changes. That's the moment. We have no cure. We have no treatment that modifies the disease once they reach middle stage. We now know we have to identify it earlier and create a plan for that person.
Well, we're a big advocate for doing that.
Absolutely.
For finding out as early as possible. Now, I do know there's some circles that say, but there's no cure, there's no treatment, there's nothing that can be done. And that could have been said many years ago about cancer.
That's right.
They didn't get the research, and it was. My grandmother died of breast cancer, and she never knew what she died of. Because nobody told her, because everybody was afraid to tell her about the big C.
What changed that dynamic?
Because
screening,
that is exactly true. And to the more information that you get on understanding what we're dealing, I mean, now our advocates, because this has many years of being an advocate, families are saying, my father, my mother, my wife, my husband died of Alzheimer's, because many times they do die of some sort of infection, and that's what shows up on the death certificate. Now that everybody's beginning to understand what they are dying from, that's where you're seeing the change in attitude.
That's right. And the real root cause may have been the Alzheimer's. One of the common infections that someone with late-stage Alzheimer's will get is actually a pneumonia.
Yep.
It's called aspiration pneumonia. because the swallowing mechanism fails.
Right.
And so they may aspirate liquid or food into the lungs, which sets that dynamic of infection in the lung. So yes, you're right. The death certificate may show aspiration pneumonia, but the real cause was Alzheimer's.
Right.
And right now, Alzheimer's, despite the fact that we believe it's underreported as the main cause of death, it is still sixth on the list of leading causes of death, and number 5 if you're over 65 years of age.
And if we really could advocate and even get more people to report the real cause of that person dying, would even change the thermometer a lot, or the meter a lot.
Brings more attention.
That's right.
Absolutely. Conditions such as brain tumors, whether benign or malignant, they can be treated. Menopause is treatable. Many women have exhibited symptoms of dementia only to find that they actually had serious hormonal changes, hormonal imbalances that could be addressed and corrected. So we now know menopause is on the list of treatable conditions that produce symptoms of dementia. We talk about Alzheimer's a lot because it is believed to be responsible for at least 70% of those who truly have an irreversible neurocognitive disorder.
One of the other gauges that really causes a change in the person's progression of the disease is pain. One of the things that you've often talked about is that there's just not enough for an Alzheimer's patient or someone having another neurocognitive disorder to treat the pain. Sometimes, and many times, that progresses the disease even faster.
Untreated pain absolutely can.
And so how does one understand that? How does one be able to tell the doctor that my husband's there's something going on with him. It seems that he can't sleep. He's very restless. And there's signs that a patient has.
Well, I think that's such an important point. Everyone has a usual. They have their usual sleep pattern, their usual waking time, their usual appetite, level of activity, and the level to which they can care for themselves. When that person deviates from that, they can't tell us because they have a neurocognitive disorder, but we know something's changed. Something is going on. The first thing to do is do a complete examination, head to toe, because we need to look for treatable conditions. Are they developing an infection? Do they have an early pneumonia? Do they have a urinary tract infection? Those are the two most common. But then, as you say, could it be pain? They can't express it.
No.
They can't say my hip hurts, my back hurts. But once we rule out medical issues, we can look to see, is there something in the history that would lead them to have pain?
And so many our patients in the past have gotten themselves into a terminology called the Baker Act. And it could be also from pain. Now, if you get Baker Acted and you're put into a psychiatric facility, you're not going to get any attention for that medical condition.
Mechanism. That's
so
right.
it creates a predicament for the family and for the process that could even shorten that person's life.
Well, the point you raise is so important. The Baker Act is a mechanism for those with mental illness, and it's an environment for treating those with mental illness. Alzheimer's disease is not a mental illness, and so it cannot be effectively treated that way. Another situation we urge caregivers to look at, and our physicians, medications. When their behavior changes, when their abilities change, is it the side effect of medications? And so many of our patients are on not only 4 or more, which we call polypharmacy, but many a dozen or more.
Yes.
And so medications can really be the source of quite a few issues, and often less is more. And we encourage our families to bring all the bottles, not a list. Bring everything that patient takes to the physician and ensure that it's looked at very, very carefully for benefit versus risk, quality of life versus quantity of life.
These are words of wisdom and words of really trying to understand the dynamics. And this is Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio 103 FM. And we're going to take a break right
Yes,
now.
And when we come back, we'll talk about some of those other irreversible neurocognitive disorders.
On Wednesday, February 14th, Alzheimer's Community Care presents a 4-hour educational program for family caregivers of loved ones with Alzheimer's disease or a related neurocognitive disorder. The program will be presented at Molly's House in Stewart from 11 a.m. to 3 p.m. Attendance is free for family caregivers. You're invited to bring a lunch, and Molly's House will provide coffee and water. Space is limited, so please register by calling 561-683-2700.
Welcome back to Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio 100.3 FM. Now we're going into our phase of talking about other neurocognitive disorders, which is really not talked about, I think, enough. And we must identify those other aspects, because I do know for a fact that the better we get at diagnosing and the better we get at a fact, and you know, you can have Alzheimer's disease, but you also can have Lewy bodies as well. And you can have other or some sort of Parkinson's as well. So it's not that clean anymore. It isn't that simple about just identifying that you have Alzheimer's.
Neurocognitive disease is not simple in any way. These are multifactorial diseases. There's no single cause. People are vulnerable for different reasons. We now know that lifestyle can play a significant role. So in other words, there are things we can do to decrease our risk. Some of those are remaining active, remaining physically active. Walking is fine as an exercise. Staying socially engaged, very, very important. Continuing to learn. I don't know, I have a theory. This is why people are staying in the workforce longer. It is therapeutic to continue working and developing and building. Your diet, Mediterranean diet, is believed by all to be a preventive diet. Again, no guarantee. Some of this is in your genes.
Yeah, genetics plays a role.
It surely does. We're learning that more and more.
I know when Alzheimer's first came out, and the discussion way back in the 1980s, and there was this big shift. You know, one time it was genetics. Oh, no, there's no genetic compound. And then when you talked about those that got early stages, well, yes, it was more genetic. And that, well, you know what? Your genes do play a role.
They do. There are rare cases of a particular gene that puts someone at risk to get the early onset.
Yes.
Perhaps in their 40s or 50s. Fortunately rare. 95% of those with Alzheimer's will be the typical age-related. And there are beliefs that 50 or 60% of those cases were preventable with lifestyle change. This is very new information, so it's very exciting. And it should motivate people to look at their lifestyle, look at their diet. Are they socially engaged? Are they challenging themselves to continue to learn new things?
And I think that when they say about women, women are more prone to get Alzheimer's than men. Well, why is that? Is it because it's the hormone change? Is there any truth to any of that? And this is what they're all studying at this.
It's all being looked at now,
yes.
Because we're realizing we have to act on the front end. There is no cure looming. There's nothing coming in the next few years. So, and again, no treatment that modifies the disease in any substantive way once they're middle stage.
They mean scientists out there, claim that we have a body that can easily last until 120 years old. So, but if you're not going to be able to have all of your other organs working
right
up to snuff, then it's not going to be the case.
That's right. So,
but you are seeing more and more 100
absolutely
birthdays. You know,
absolutely. It's commonplace now. It's not unusual.
That's right.
And I've been in facilities where we had residents who were 105, 107, and highly functional and really doing quite well. So again, Alzheimer's, your greatest risk factor is age. That's the only one you can't modify.
No,
we can't stop the clock, but we can modify diet. We can stay socially engaged. We can get exercise. We can learn new things.
And certain types of exercise, like they say, dancing is terrific.
Dancing is wonderful. It's the reason I take tap. It's an incredible mental challenge to learn the steps and follow and memorize. Keep the rhythm. But again, Alzheimer's, 95% of cases will be those that are age-related, over 65. But we now know that possibly 20 to 30% of those who have been told they have Alzheimer's may actually have Lewy body disease, which is a different dynamic. It's a malfunction of a different protein other than those that malfunction in Alzheimer's. And it will have similar effects. It may strike a little younger, maybe as young as 60. But there are significant differences in how Lewy body begins. So if we know that and we know symptoms to watch for, we can actually get to that neurologist that can parse out what we are most likely to be dealing with. Lewy body doesn't begin with memory loss, but it may begin with what's called REM sleep disorder, where the caregiver will say it's like he's acting out his dreams at 2 o'clock in the morning. Yeah. We hear that a lot. Gait will change. The way they walk, they may lean forward, they may shuffle, much like Parkinson's. And that's not unusual because Parkinson's disease has that same protein malfunction in the midbrain. So we're now learning more about Lewy body. We're learning how to identify it. There are specific clinical trials for Lewy body, so it is important to know the difference. If someone has Alzheimer's, they should not be in a Lewy body trial, most likely, or vice versa. So we're very fortunate in South Florida to have so many experts.
And the same misdiagnosed or underdiagnosed or whatever is frontal temporal lobe.
Absolutely.
And that does not, that's not like Alzheimer's.
Completely different
memory
dynamic.
Loss doesn't happen that early.
That's right.
And their judgment is not off, but it's all the other ramifications.
But frontal temporal disease, I can strike so much younger.
That's right.
Such a much more of a burden on the family and on the patient for being so young, possibly as young as 40. Yep. I'm proud to say we have one of only 2 support groups for those dealing with frontal temporal disease at our West Palm Beach location twice a month.
Yep.
Because for those caregivers, this is an incredible challenge, and we're fortunate to have a former caregiver of her spouse with frontal temporal disease to actually lead that group.
That's right.
And really does understand. For more information, by the way, on support groups, you can reach us at 561-683-2700, or you can send us an email at info@alzcare.org. That's info@alzcare.org.
And this is Alzheimer's Sunrise, shining a light on patients and caregivers on Legends Radio 100.3 FM. But sticking with our subject matter and talking about the other related disorders or the other we like to use the word neurocognitive disorders because that really states more the whole overall different disease processes. And it used to be that people would think that Alzheimer's was the umbrella, but it really isn't.
No,
and neurocognitive
it's
disorders,
one of.
Yes, it's one of. So that's what I think is going to be a big help for families and for physicians to really start kind of focusing in on and being much more accurate about coming up with that diagnosis.
Absolutely, and we need them not to only focus on those over 65. There are much younger people who can demonstrate irreversible neurocognitive decline, unfortunately, because of trauma. And we're learning about this now from contact sports,
right,
or one significant dramatic event that produces a serious head injury, like a severe auto accident or a fall. So we really want our medical community to be looking at all of their patients, getting that social history, getting that history of accidents and injuries and whether they played contact sports, because these are things that do put us at higher risk for an irreversible neurocognitive disorder.
The signature of this war that we're into over there in Iraq and Iran is head trauma, because the Jeeps get blown up and they're bounced around, and that's a concern. We're in the World War II veterans. It was shrapnel, so
that's right.
It's this. So we are having a lot of other challenges in this treatable in this environment when it comes to Alzheimer's disease and related disorders.
So my point there then is that we don't reserve this evaluation just for those over 65. We have to make it part of everyone's annual evaluation. What Look, your heart is very important. Your lungs are very important. Your kidneys are very important. But your brain is incredibly important. And we need to apply those same preventive strategies and that same screening approach to how our brains age and what we are doing to keep them healthy.
And there is a saying that we have at Alzheimer's Community Care that what's good for the heart is good for the brain.
Absolutely.
And that's in your eating habits again. And let's go back
That's
to
right.
that whole
And exercise.
Yeah.
Not smoking.
Right.
Anything that is heart healthy will be brain healthy. So that's an easy way to start making some changes. Just using your non-dominant hand. That's easy. Anyone can do that. Things you would typically do with your dominant hand, try purposely engaging the non-dominant hand. It actually wakes up the other side of the brain. Left side of the brain operates the right side of your body and vice versa. So your non-dominant side might be lazy. You can exercise it by using your non-dominant hand.
So you're an advocate for all these brain teasers that
Absolutely.
they have out there coming in. And there is a lot of other stuff, this other avenues out there. And yes, crossword puzzles. But however, even at that time, crossword puzzles might not be that great because you get used to it. And anything.
Once you get good at it, you need to change.
And
that's right.
That's the challenging part about our aging and making sure that we age healthy.
That's right.
That
Absolutely.
is for sure.
The point that is so important here is we're not helpless with Alzheimer's. The thought for a long time was you either get it or you don't, and there's nothing you can do. The most exciting news now is we know there are things we can do. We can act at the earliest moment if we have symptoms, but better yet, we can adopt those preventive lifestyles and decrease our risks.
So the message is really, let's not keep kicking that can down the road.
Exactly.
About not getting that medical examination.
Exactly.
And not fighting for making sure that we understand what the real diagnosis is. And it shouldn't be just, oh, he's got dementia. I cannot tell you how many families come in.
We hear it from most, and that was the diagnosis they were given.
That's the heartbreaker. And of course, once that person becomes in our life and we're working with the family, so many other things we come to recognize as probably another type of related neurocognitive disorder.
That's right.
And so that's of help. But, we've lost a lot of ground in the process.
We
have.
have.
A lot of planning and a lot of other things going on. And so this is what we advocate at Alzheimer's Community Care, to try to get the interventions as soon as possible.
Absolutely.
So this is, we've just finished up this wonderful talk on a very important subject, which is understanding that there's something more out there than just Alzheimer's. There's something out there that's not just dementia, that you want to really understand what that diagnosis is. And so the other programs that we're going to be looking at is, with law enforcement and having them, dealing with scams and other types of societal issues as well. So this is Mary Barnes
And Karen Gilbert.
at Alzheimer's Sunrise, shining a light on patients and caregivers.
Thank you.
On Legends Radio 100.3.
Thanks for listening to Alzheimer's Sunrise, lighting the way for patients and caregivers. To learn more about the help and hope available from Alzheimer's Community Care, call 561-683-2700 or visit alzcare.org. That's ALZcare.org. Tune in next Sunday at 6:30 for another edition of Alzheimer's Sunrise, lighting the way for patients and caregivers right here on Legends 100.3.